This is the Hope Not Note podcast,
where we answer your questions and share inspirational stories to fill your soul with hope.
Our mission is to empower hope to those who have been plagued by nope.
I'm Dr. Dylan Caswell.
And I'm Brandy.
And we're here to bring you out of the nope and into hope.
Welcome to episode 11 of the Hope Not Note podcast. We are so excited that you are tuning in and listening, and we are thrilled to be here with you. I wanted to share a little story that happened to me this morning, and that's my hope story. And so this morning I was driving and I was going from one place to another, meeting a friend for breakfast. And I'm lived here in Syracuse for 7 years now. It's officially 7 years as of yesterday.
Wow.
And I know the city pretty well, but for whatever reason I put on my GPS, just because usually I don't go from this one location to the other. And I knew how to get there, but I didn't know how to get there the fastest. And so I saw, the maps, and I was like, oh, well, I don't really want to get on the highway. I'd rather go this way. But then I ended up following the GPS anyways. And I pulled up to the stoplight, and the car in front of me almost ran the red light, stopped, and then put their car in reverse to back up. And so I was kind of first, but then I wasn't. And there was this gentleman who was standing there and just holding a sign, smiling ear to ear, not even paying attention to that weird car thing happening. And I was just smiling. I was like, look at him. So I rolled down my window, and he came up to me, and he ran over to me, and he was like, hi. And I was like, hi. And I was like, I don't have anything for you, but you were just smiling, and I thought looked like you were having a great day. And he was like, well, it is going to be a great day. It's beautiful outside. And his sign said something along the lines of, veteran, I have a bad heart, anything helps, God bless, or something like that. And I asked him his name, and he goes, my name is Raymond Peterson. And I was like, well, hi, Raymond. I'm Brandy. It's so nice to meet you. And he's like, it's nice to meet you too. It's so nice that someone just wanted to acknowledge me today and say hi and roll down their window just to talk. I really appreciate it. And it was 8 o'clock in the morning, so I'm hoping that other people will chat with Raymond throughout the day today. And honestly, it brought me so much joy, and his smile was just priceless. He really, it really seemed like no matter what his circumstances, he was doing his best to be joyful. And I asked him, do you think today's going to be a good day? And he was like, yes, it is. And yesterday was awesome. And we started talking about the weather and how the past couple days in Syracuse have been just these perfect 75-degree sunshine weather with the light breeze. And I don't know, Raymond, if you ever get to listen to this, know that I'm thinking about you, because you just brought me so much joy, and keep smiling, because your smile really is infectious.
Wow. I love that story on so many levels. My hope story is not down that avenue, but to tie it together, I'll start by saying, when life gives you lemons, and then we're not going to finish it. We're going to continue the story, then come back to that statement. Okay. So my hope story comes from my dad. That I talked a little bit about him on the last episode. My dad bought a sword. It's episode 11. So it made me think of the 11 kind of looks like a sword. Okay. So it made me think of the sword and how my dad bought this sword. And why is that my hope story? He bought it at a car show. My dad, the whole year, looks forward to this one car show. Mm-hmm. He has an old 55 Chevy that he's been working to fix up, and he's maybe brought it to this car show once or twice. And he was really looking forward to this year to fixing it and having it there. And there's something to be said about it being different of driving your own car in for the car show versus going and walking around. And I mentioned on the other episode, he works incredibly long hours. He's a truck driver. He doesn't have a lot of time to work on his car. And when I got to be this year, around the time of the car show, the speedometer, the speedometer started working, but the carburetor wasn't working. So I kind of made the joke of, well, dang, Dad, the speedometer finally works, but the car can't go anywhere. And it was a little too soon for that joke, but I think now he laughs at it. But anyway, the carburetor in it was bad, so he had to get a new carburetor, and it was going to be a while for him to get it and to be able to put it in. So he was a little bummed because he didn't get to drive his car to the car show. But he still went anyway, and he was a little limited on his money. He bought a carburetor at the car show, which he was really happy about. And then he found a sword for $20. And not only did he buy this sword, but he went around showing it to people. Look what I got. I got my sword. And everyone's like, oh, cool, dude. And then when Brandon and I met up with him and asked him, hey, how was the car show? The first thing he said was, I got a sword. And he was so excited about this sword. He's pumped about it. So my thought was, when life gives you lemons, buy a sword and make lemon slices instead of making lemonade. But it goes back to what we were talking about previously on episode 10 of just like finding those little things that really help to lift you up, that get you excited. I'm excited. I want to buy a watermelon. I want to buy an apple. I want to buy lemons. I want to go over and play real life Fruit Ninja with my dad. But now it gives us both this activity to bond about. And this past weekend, we were watching this movie called Senior with Robert Downey Sr. and Robert Downey Jr. I say those right?
Yep.
Yeah. So this movie is just this beautiful documentary of Senior who has Parkinson's and is starting to decline. And Junior wanting to be there with his dad, learn more about his dad, and to give him joy. So they put together this film. They filmed this documentary, and for reference, his dad was a filmmaker. When you have Parkinson's, you lose executive function. You have a flat affect. You don't really laugh as much anymore. It's hard for you to move around. Your memory starts to kind of go a little bit. And Senior did not have that when they were making this documentary. He was taking them to all these different places. Oh, I remember back in this time when we filmed this here. And he's laughing about the takes because they're asking him questions and he's not giving the information as to why he's doing this.
He's such
this
a quirky
creative
guy.
genius and all that. But seeing that, really, it was Junior that wanted to do this to get closer to his dad. And he knew that it would keep his dad busy and it would keep him happy and that he'd be laughing during it. So watching them come together was so beautiful of this activity. And then there's this one moment with their grandson where their grandson goes, I want to go with you to visit Grandpa because I don't know how much longer I'm going to be able to see him and make memories. So can I go with you to make those memories? And it brought me back to the point of like, our parents aren't perfect. Nobody is perfect. But spending time with them is all that they want. Whether it's fixing up a 55 Chevy, creating a new documentary, playing Fruit Ninja because your dad bought a new sword, like whatever that may be, that time is so precious and so valuable. Even just calling your parent this week, if you still have them here on earth, give them a call and just chat with them. Even if it's 5 minutes.
Well, you do great. Like every year for your mom's birthday and basically any holiday, she asks for time. You know, she doesn't need a necklace. She doesn't need a fancy anything. She literally just wants time. And I think, you know, time is so important and so precious, and we can give our time so beautifully to the people around us. And, you know, whether that time is taking her out to lunch or the time is the 10 seconds before the light changes to talk to the guy on the side of the street, like that is valuable time. Don't waste it.
Yeah.
Wow, I love the hope stories from this past week. They're so great. Let's hop into questions. Our first question is from a listener named Mark, and he says, I'm a very active person and drink multiple gallons of water every day, yet still feel thirsty and dehydrated throughout the day. Do you have any advice?
Mark, great question. Is this Mark with a C or a K?
Okay.
Okay.
Yeah.
Just wanted to know.
Okay.
Yeah. It's like when you meet someone with Sarah, is there an H or not an H to it? It's the stuff you need to know before you give the answer.
Of course. I forget that Mark can be spelled with no K.
Yeah, because if you have a C or a K, then the recommendation's different based off of your name. No, I'm just kidding.
Oh my gosh. No, it's not. No, it's not.
So a couple different ways to go with this. That is not the answer. But what the answer would be is I want to dive into more of what are you hydrating with? And I'm not assuming, in any case, I'm not assuming anything, but I have worked with people that they go, I am hydrating throughout the day. I start my morning with coffee, then I have tea, and then I have a small thing of soda at lunchtime, and then I have soda again at bedtime, and then a coffee like right before bed. And I'm like, all of those dehydrate you. But they go, well, there's water in it. So therefore I'm hydrating. And that's really not the case. So I want to know, what are the sources that you're using to hydrate? Is it water sources, or is it water with all these different additives that are mixed into it? What's your caffeine intake? What's your salt intake? How much, like food wise, what are you putting into your system? Because that can either dehydrate or rehydrate. I know when I feel really dehydrated, I'll eat a cucumber, and the cucumber has a ton of water in it, and that helps me to feel a little bit more hydrated. There'll be times that I hydrate too much, but I don't have enough salt in my body. Salt likes to keep water. And so if you have too much of it, your body won't get rid of the water. And if you don't have enough, you'll kind of keep peeing throughout it. So, if you're feeling like you're dehydrated and you're hydrating, you can tell by the color of your urine if you're hydrated or dehydrated. It doesn't need to be clear like water, but it should be this lighter color, like close to clear. I can't help but think of dodgeball. Why do you drink your own urine? Because it's sterile and I like the taste. Don't take that as a recommendation either. You don't need to drink your urine, but the color of your urine will let you know if you are truly hydrated or not hydrated. The clearer that liquid is, the more that you are hydrated. And you can just, as you're peeing, just take a quick glance at the stream or the toilet water, and that will inform you on that. If it's more of a darker color, like more of a yellow or like just a darker yellow, that's signifying you're not getting enough hydration. The other thing I would add into that is looking at like what is Mark's activity level, how much is he sweating, what is he doing throughout the day, that he may feel like he's getting enough, but because of his activity level, he may need much more. These athletes that go on summer weekend type tournaments and they're playing 5 games a week and they're playing down south where it's like 98 to 105 degrees and you wake up and you're sweating and you get on the field and you're sweating even more. And then by the end of the day, you're still sweating. Like they may need more replacements of hydration than someone that doesn't have that activity level.
That makes sense. Can I ask a follow-up question? Because I'm just curious. So for Mark, say he works out regularly and drinks like just water throughout the day, but a lot of the water, but still feels dehydrated. I guess 2 questions. 1, can you feel dehydrated but not actually be dehydrated? And then 2, is using like liquid IV or Gatorade or something like that a good option? Or should you just continue to stick with water and drink more water? Or I feel like you mentioned salt, so should he start eating more pretzels in his diet? Like those are the things that I thought quickly.
Great question. I'll try to answer it and then let me know if I don't hit one because I'm trying to process them all as they're asked. So first we'll start with, can you have the perception of feeling like you're dehydrated, but the reality is that you're hydrated? And to be honest, I don't know the full answer behind that, but I can pull from other sources that tends to show us that our subjective perception tends to be inaccurate of objectively what's happening. And this is kind of, again, not hydration, but something different in people when we do their muscle strength testing, because we're using a dynamometer, we're using objective numbers that cannot be debated. And the person will go, wow, I thought my left leg was weaker than my right leg. But then they get the objective test and they go, oh my gosh, the left leg is actually stronger than the right one. So the perception didn't actually match the output. So how would you know this is the case with hydration or dehydration? If you feel like you're dehydrated, but your urine is showing something different objectively, well, that will let us know that the perception is inaccurate from what's actually happening. And if you're still feeling that and want more, then I would say, well, then we probably need some more objective testing, whether that's getting your urine tested, your blood done, systemically, is there something going on with your kidneys and the filtration? Like, is something happening there that needs to be looked at? So that's a big thing to kind of understand that if I'm still feeling that way and I'm not sure, I'm uncertain, there's really great tests that you can use that will help you to determine that. So if you did those things and the test come back negative and your urine is a great color and you're still feeling like you're dehydrated and your salt levels are good, well, then we know that it's perception that you're not feeling hydrated. I will say, kind of going off of this, and then, well, what's leading to that perception? And what leads to that perception is the mouth feeling dry, right? If our mouth feels dry and our throat feels dry, that can lead to the feeling of being dehydrated, when the reality is like, no, our body's very well hydrated, but because of this sensation, our brain's interpreting that as we're dehydrated. When I was recording the audiobook, I learned all these things about hydration and keeping your windpipe and everything kind of lubricated. And some were saying like, get vegetable oil and just take a quick shot of that so that like you keep everything loose in there where you're not feeling dehydrated. So I would go in to say, not that Mark is a mouth breather, but mouth breathing Mark might be feeling that happening, that if you're breathing through your mouth, your airways are going to dry. we are meant to breathe through our nose, back out through our nose. We have passageways that increase the humidity of the air to make it more comfortable for our breathing system to happen. So if you're bypassing your nasal passage and breathing through your mouth all day, your mouth is going to start to feel like it's really dry. You're going to feel dehydrated, but the reality is you're hydrated. It's just the breathing is drying you out. And you keep sipping on water, but then you keep mouth breathing because you have to breathe throughout the day.
Of course.
So if you're not doing that and you're not breathing through your nose, there's other consequences that don't want to go down into. So make sure that you're looking at your breathing pattern and then trying to establish yourself to be a nasal breather as much as you can. There's some conditions that allow people to not nose breathe, like deviated septums and things like that. But for the most case, you can nasal breathe. It's just uncomfortable to do at first. The reason that people start mouth breathing is because of a stressful response. Mouth breathing is a learned habit. So people, they get too stressed or something threatens them in their environment. Their brain goes, we need to fight or flight. To fight or flight, we need oxygen. We don't want to wait for it to come in through our nasal passage and get warmed and then go down into our lungs. Let's get a quick gasp of air in and then go from there. So if you're very stressed, you're not having good coping in your mouth breathing, that can give you the feeling of like you're being dehydrated. I think I answered them all, but I'm not sure. Anything else?
Well, I think the other one was like, do they need to supplement with like liquid IV Gatorade or anything like that?
Gotcha. Okay. Yeah. So these supplemental
great
drinks.
Answer. I have a bunch of follow-up questions, but for the sake of the podcast, I will not be asking them.
So these other drinks that you can put in, I get it. Like my main liquid that I'm drinking is water. It gets boring. It gets so boring. So I like having limoncello, like a sparkling water with a little bit of lemon in it. I like having different flavorings of water. I like tap water. I like warm water. So I try to switch it up to get different types of water because it does get pretty boring. There does get to a point where I'm like, I'm sick of water. I just need something else. And then when we start looking at these something else's, Gatorade Zero, it is a trash drink. It is not good to be putting into your body. They market it as Gatorade Zero because there's zero sugar in it, which is a good thing. But then when you look at the additives and the chemicals that they create synthetically to put into that, it's terrible.
Bad news bears.
It's bad news bears. And I saw this the other day, but you can make your own homemade Gatorade. Use water, you boil ginger, you put in a little bit of apple cider vinegar, and then you squeeze lemons into it. And if you want to put a little tiny bit of sugar or honey for taste, probably would go with the honey, more natural, raw honey. And it will give you the taste of Gatorade, but it doesn't have all the negative additives into it. Liquid IV, kind of same thing. If you're in a pinch and you need something to change the taste so that you're getting more of a volume in, it's okay, but it's really not the best thing to
and
be
neither
put
of them
into
are
your
going to
body.
like hydrate you better.
Not really.
Not really.
The only reason they would hydrate you better is because they allow you to drink a higher volume of it because you're not as bored of it. You know, so like liquid IV, the lemon one, you put that in, you can slug 16 ounces. If you saw some, you can put it in and drink another 16 ounces. It gives your taste buds a party. So then you're like more willing to drink more of it because of that. But in of itself, it's not actually hydrating you more from that thing that's put into it.
Okay.
With the exception of being, if there's like, you're really low on salt and you just have water and you sprinkle some salt into it, then that may help hydrate you because you're not losing as much water.
Okay.
But then if you have too much salt, it's hanging on to too much water.
Right.
So there's moderation,
a balance in that.
Yeah.
Okay. Mark, great question. I personally have a bunch of follow-up questions, but for the sake of the podcast, we'll have to move on. But thanks, Dylan.
Thank you, Mark. And we will not call you mouth breather, Mark. It just was flowing and fit well. I don't think that you're a mouth breather, but just something that came up.
Yeah. Hopping into Claire. Claire asks, what is your insight on autoimmune disorders and other chronic illnesses that may not, quote unquote, have a cure? And she lists type 1 diabetes, Crohn's, asthma, etc.
Phenomenal question. I'm usually not going to subcategorize things, but in this case, I'm going to, because there's autoimmune, there's chronic conditions, there's things that people are born with, like type 1 diabetes, and there's things that can be developed over time. So I want to differentiate those two to begin with,
Sure.
right? Because what I'm going to say about the category of the things that are developed, I do believe that those can be treated, and I do believe that those can be cured.
Mm-hmm.
For things like type 1 diabetes, the treatment is injecting insulin because you don't have the cells to be able to create the insulin within your body.
Mm-hmm.
So there's not a cure to type 1 diabetes. There's a treatment for it. But some of these other ones that are developed, like fibromyalgia, for example, Crohn's disease later on in life, ulcerative colitis, like these other things that come about, I do think there is treatment for, and not just the treatment, but the cure. So I want to start with that. And then I'll go into, well, how do we look at autoimmune conditions, right? So the immune response is your system's natural defense to take down something that it's identifying as a threat, whether it's a bacteria, whether it's a virus, whatever the perception has become of the threat, the immune system puts in a response to attack that thing so that after it attacks it, it cleans out the debris. Now you can heal, regenerate, and become more robust, more resilient than you were before. So the immune system is a beautiful thing, right? And it gets stronger and stronger and stronger the more inputs that it gets. So as a kid, eat some dirt because your immune system is going to develop and become stronger to that, right? You get a vaccine. The vaccine's not a cure. The vaccine is giving you that virus. It's a dead strand of it. So now your body is creating a defense mechanism against that. And it's also working off of prediction. Oh, I've seen this thing before. I created the cells to attack it. So if I see this thing again, I can create these cells to go and attack it because I have memory of how to get there. So in these autoimmune conditions, and then auto means self, right? It's that person's system. It's their own system that's doing this. So autoimmune is the person's own immune system attacking them.
Mm-hmm.
Then we have to ask the question, why is it attacking itself? And what we tend to think is, oh, it's because my immune system is bad. I have a bad immune system. No, you have a very accurate immune system. You don't have good cells or bad cells. You have cells that are doing what they're told based off of the message that they're given.
Mm-hmm.
They are being given the message to attack. So we have to figure out, why are they getting that message of attack? How do we change that message of attack? And what we've learned with a lot of clients that we worked with these autoimmune conditions that are, again, in this category as they've developed over time, is that they've been attacked so often from a lot of different angles, a lot of different events, a lot of different people. They've been rejected so often that their body only seems to have one prediction left, which is to now attack itself. Because if everything else is attacking me, then the environment must be right. I must have to attack myself. So now it starts looking at things that normally wouldn't cause an immune response. Now is causing an immune response because it's like full warfare ahead. Attack everything that's coming in. So now people start having a reaction to sugar when they didn't have a reaction to sugar before. They start having a reaction to this food when they didn't have a reaction to this type of food before. And then it gets blamed on the autoimmune condition as to why that's happening, instead of taking that step back and saying, well, no. Your whole system is attacking this thing because you're attacked. You're feeling attacked. Can we sit down? Can we go through what has attacked you? Your beliefs as to why you've been attacked. Your beliefs on what this disorder is. Your beliefs on if you think that you're stuck with this. Your beliefs on what this thing actually is. Have you heard of people healing from this before? Can we start to change your perspective? Can we get you to love yourself? Because once you truly start to love yourself, and once your soul is aligning with what your body is asking it to do, your body will start to take care of itself, because now the cells are getting a different message. Instead of the cells getting the signal of attack, they're going to get the signal of rebuild. Don't need to attack this. And now we can start building this back up piece by piece by piece.
Wow, that's so beautiful. I think a lot of people have these different chronic illnesses or autoimmune disorders, and they just kind of throw in the flag and say, this is going to be my life for the rest of my life. Like this sucks, but like I have to deal with it. Or they, sometimes there's like blame of genetics, or like my mom has it, so I must have it. But you're really saying like there's a level of environment and rejection that you may have gone through that your body is now rejecting itself.
100%. And genetics set the stage. Genetics set the stage, but environment is what allows that play to happen. So we cannot just say it was genetics that did this. It was genetics that caused my fibromyalgia. No. There might have been genetics that predisposed you to this, but then you went through childhood abuse. You got rejected at school. You got fired from your work. Your significant other left you. That environment now set up the stage for fibromyalgia to perform. We cannot change the genetics, at least that's what we know now, but we can change the environment.
Mm-hmm. Wow. Thanks, Dylan. Mm-hmm. And Claire, thank you for that question. I think it's fascinating. And I think I personally know that not every healthcare provider or doctor think in this way. And so this is a really unique perspective that I think a lot of people should dive into. And, we post these podcasts bi-weekly now for the sake of soaking this in. And so if you're listening and you have an autoimmune or you have a chronic illness or you know someone that does, and the reality is you probably do, because that's the world we're living in right now, especially in the United States, maybe this is the question that you need to sit with and let it simmer for the next couple of weeks and really ask yourself, what does this mean for me and for my loved ones?
Yeah. And not to open up another can of worms into this, but, we're seeing autoimmune conditions on the rise. Mm-hmm. We're also seeing separation on the rise, right? And again, not saying this is a causation, because that will get me in trouble with researchers, but there is this correlation, and correlations can be attributed to a lot of different things. But what I've noticed is that autoimmune conditions have gone up as there's been more separation. And by more separation, I mean more in the environment of one side versus this side, very dogmatic. It's this way or nothing. And then there's a separation of the person's body and what their soul is asking them to do. So many times people spend their lives trying to make other people happy and to give to them, which is great, but there's a level of sacrifice and a level of what your soul is asking you to do. Everyone here has such an individual, beautiful talent that in most of the world is untapped, because people spend too much time doing things that they were not meant to do. And as they continue to do that over and over and over and over again, eventually the body starts saying, well, I don't want to be doing this. Like, get me out of here. So the immune system goes, got it, heard the message, let me start attacking so that we can get rid of these things and start generating these things faster and faster and faster so that you can get to where you want to go, right? And that's the important message, is that you are constantly moving towards your strongest thought. And whatever that thought is, your body's going to go right behind you and go, all right, I'm with you. So this autoimmune condition and idea, it's not that your immune system is inaccurate. It's not that your immune system is bad. It's that the signal that it's getting is saying attack. We need to change that signal. Change the signal to the cells. Start living that life that you were meant to live. And that's really our goal at Hope Not Nope, with the book, with Hope Coaching, with everything that we do, is to allow people to come alive. That you've been dealt nope, you've been plagued by nope. We want to empower you with hope, and we want to give you hope in that framework so you can live the life that you were intended to live. And deep down, you know what that life is. You've had visions of it, you've tasted it, but you think it's so far away, and it almost paralyzes you from making those steps. Just make that one small step. And again, in this category of immune conditions that are developed over time, they can, in my opinion, not just be treated, but they can be cured. And we talked before about hang in there. No, we're done hanging in there. Let's get you out of there. Let me reach my hand down, hold on to my arm. Let me pull you out of this, and then let us guide you to get to that step.
Yeah. Awesome. Great job. I love that question. I love that answer and question. Let's hop into the next one. This is from Jane, and Jane says, as I'm getting older, my doctors keep hinting at having to have procedures done or take medication in order to have a better quality of life. What are your thoughts on this? Can hope be created with no procedures and with no medication?
Wow.
I feel like that's a good follow-up from the last question.
Jane, phenomenal question. And I'm trying to think of where I want to start with this. And I think where I want to start with, what are your goals? And if that provider is not aligned with your goals, find a new one. Get a new person on your team, because ultimately think of yourself as an athlete, because you are an athlete. Everyone's an athlete that's living out these values, right? So you get to decide who's on your team. You're building your team. You're getting the quarterback, you're getting the coach, the GM, you're getting all these people. And if they don't have your back, find someone that will have your back. I also get fired up because I won't use names, but what's happening now, and to shed light on the system, I had a patient who is a younger individual, very healthy, on a great path to become who she's intended to be. She is awesome. She got a call and gets calls yearly from this one office. Again, I won't use names. And the office says, "Hey, how's your knee doing? Because your knee's degenerating. You know, you might be 40 soon, and you should have a knee replacement as a preventative measure." What?
That's ridiculous.
When did a knee replacement become a preventative measure?
Right.
A knee replacement is that you've done everything else in your power. There's nothing left. So then you go in to have that procedure. Not as prevention to a 30-year-old. Thank the Lord she's medically and health literate that she hangs up that call and says, "Stop calling me."
Yeah.
But in my opinion, that is negligence. That is, you are intentionally creating harm by telling people that they need a preventative knee replacement.
Right.
That is terrible. If I had a provider in that office, oh, I'm doing more than firing. I am causing a scene, because that is ridiculous.
Wow.
Because
Yeah.
providers take an oath to do no harm. And if you're intentionally creating harm in order to get more patients in, to get more MRIs and do more surgeries, like, no, that is not what healthcare was created for. Healthcare was created to make you whole and to make you feel whole, not to cut you apart, put a new piece in, and then go, "Oh, that part's good. Go figure it out from here." With that being said, we should probably give the other side of the story, that there are times that medication and procedures are needed. You know, you have a bucket handle tear in the meniscus and your knee's locking up on you. It's buckling, it's getting stuck, there's pain, there's swelling. You've done conservative methods and you haven't had a response. Might be a great time to go get surgery and just get that flap taken care of. If you have a degenerative meniscal tear, well, the research is showing that you can have the surgery or have a placebo surgery and have the same exact outcome at 1 year, 2 years, and I think 5 years now, which was Chabon et al. I think it was a Scandinavian Journal of Sports Medicine. It was a journal in Europe that they did this in. Same thing's been shown for the shoulder decompression surgery, where they shave down the end of the clavicle to give more space for the rotator cuff, because that was thought to be given shoulder impingement, which now has been shown not to have the case, because people that actually have shorter subacromial arches had decreased occurrences of shoulder impingement compared to people that didn't have that space. So that's been all kind of shifted around.
Yeah.
But they used to do this shoulder decompression surgery. Well, research shows that you can do the decompression or you can do a placebo surgery where they make stitches, close it up, and your outcomes are the same at short-term and long-term, both functionally, pain, and disability. So there's a lot of times that we don't need procedures. There's a lot of times that we don't need medication. There are times that we do need procedures and medications. And so people will come and say to me and say to us, like, "Oh, so you don't believe in surgery, you don't believe in medicine." No, we want to declutter the healthcare system so that when a person needs a surgery, the surgeon has the time to be with them and to do a really great surgery, versus them being pressured and burdened and burnt out because of all the things that are coming into their office that they shouldn't be evaluating or taking care of.
Right.
So there's a time and place for it. There's a time that's not needed. Can hope be earned without having a procedure? Absolutely. Can hope be earned because of a procedure? Absolutely. Example I can use here. When I was in my sophomore year of high school, my appendix almost ruptured. I had to go have my appendix removed.
That's a surgery.
That's a surgery. That's a procedure. Having that procedure gave me hope because it gave me life. Because if that bursted and it was still inside of me and that content got to the rest of my GI system and my abdominal cavity, I wouldn't be here right now. I had an infection in my hand that traveled up my arm and went septic and almost passed. Having an antibiotic gave me hope because it kept me here to now do this. So there's a time and a place for all of these things. It's just better identifying what is the time and what is the place.
And what are your goals going into it?
And what are your goals going into it?
Yeah. Awesome. Well, great answer and great question, Jane. I don't really have much more to add because I just agree with you on all that. So great job. But Jane, Claire, Mark, thank you so much for these awesome questions. We are so thankful Listeners, please head over to our website, hopenotnope.org, where you can answer or you can ask us questions that we will answer on future podcasts. And please rate, review, share this with a friend, like it. Head over to Apple. On Apple, you can leave a review and actually write your thoughts and give it stars. But then on Spotify, you can just do the stars. And both are super helpful. So if you're like a Spotify girl, I'm a Spotify girl, head over to Apple and just go help out for the day, and maybe vice versa, just because it's helpful. And if you're enjoying this content and you've listened to all 11 episodes, we appreciate that help. So we appreciate you, and we hope that this continues to encourage you.
Have a great week, and remember, every day is not just a day to be hopeful, it's an opportunity to become hope.